So I'm Dr. Priyanka Pawar. I'm a research fellow at Grid Council and I'll be the rapporteur for this webinar. So over next 1 hour, we have our esteemed panelists who will be talking about their experiences, insights, knowledge, as well as sharing the challenges and opportunities in the health tech field. So, whether you are a medical doctor, a public health professional, or a health tech enthusiast, or someone who is just curious and wants to know what is in there in this field. So, I think this 1 hour will provide you with some valuable information that will help you to understand the potential of health tech field. So now to set a context, like why this webinar? So I think we all know that technology has always been part of healthcare for long. And over the last few decades, it has encouraged a lot of innovations as well as health tech startups to address the healthcare issues. So also, it is reported that the Indian health tech ecosystem or the Indian health tech industry is about to rise and grow up to $5 billion in 2023, and it can go up to $50 billion in next 10 years. So, with this background, it definitely becomes imperative for all of us to understand what exactly happens in this health tech startup. What do they exactly do? How do they develop innovations? How do they develop products? How do they make it market ready? And what approach should we have as students, as medical professionals, as public health professionals when it comes to health tech startups? So, also, when we think of the Indian health tech ecosystem, there are regulations, compliance. However, there is no standard set guidelines or training regarding this. So we would be having our panelists touch upon that, discuss upon that too. And as our webinar talks about designing innovations for India. So when we think about designing, so there are a lot of health techs and they are coming up with a lot of products, but still they are not able to produce market ready products. And when we think about market ready products, there's a need of a concept which is a human centered design approach. And when we talk about this approach, it basically considers the needs and context of the user. So we would also have our esteemed panelists touching upon how a product is designed or how an innovation is designed. So majorly the key points to be discussed in this webinar or what we will be going through about is the academic perspective, what are incubators, why are incubators, then the AI assisted innovations in our country, and the scope of remote patient monitoring. So, with that background, I take pleasure in introducing Dr. Achal Shetty, who is going to be our moderator for this webinar. So, Dr. Achal Shetty is a assistant professor at Department of Community Medicine at Father Muller Medical College, Mangalore. He also holds MSc in psychology and diploma in community mental health. So with this impressive background, he is also keen on understanding and learning about this rapidly evolving field of health tech. And he also considers himself as a health tech enthusiast. And he also has done a lot of research when it comes to health tech, where he has managed research projects based on mobile based applications for monitoring and point of care screening, as well as done research or on understanding the efficiency of AI. So with that, I would welcome Dr. Achal and thank you for agreeing to moderate, and you can please take it ahead from there. Thank you so much.
Thank you, Priyanka. Okay, good evening, everyone. My name is Dr. Achal. So, to start off directly, let me reiterate what our agenda is for today. Okay, so today we are gonna follow a flow, a system where we are gonna start with an idea, okay, and we are gonna see how this idea can go all the way till it reaches the stage of a product. Now, this means that it can start as a student sitting in a classroom, coming up with a brain, an idea, and he or she has to carry it forward till it becomes a successful product. So for this, we have three different approaches. First, we are going to look at the academic aspects, where one person, student is having all sorts of duties, exams, whatever it is. Still, what can they do in that context to go to the next level, right? So that is one. And the next speaker is going to focus on artificial intelligence, which is such a powerful technology now, how it can be used. It can be used as a tool to improve your product, or that itself can be one major breakthrough. And finally, we are going to take this discussion towards a direction where we are going to focus on devices and how to bring them to the market. How about its certification? What were challenges? And for this, we are going to use connected healthcare and remote patient monitoring as the example. All right. So this is our agenda for today. This is how we are going to go forward. So starting with the first topic, I would like to quote a psychologist named Kurt Lewin. He said, there is nothing more practical than a good theory, right? So we want to learn the theory, and that's why many of us have been through colleges. But that doesn't mean that we have to wait until until our course gets over, until all of the knowledge is imbibed in ourselves to start working on that. So a student can start somewhere in the middle and go ahead with his or her innovations, directly entering the market. All sorts of activities are encouraged now. And we all know all those successful tech leaders who have dropped out of college. I'm not encouraging anybody to drop out of college here, but at least the idea is that you can start working as and when you are learning, right? So for this, to talk about this, we have with us Dr. S. Rubin. Welcome, sir. Dr. Rubin is working as the Associate Professor and HOD of the Postgraduate Department of Software Technology, AI, MIT, St. Aloysius College, Mangalore. With a PG teaching experience of 20 years, he is passionate about teaching and loves to help students achieve their life dreams. He has gotten grants from Vision Group of Science and Technology, Government of Karnataka, UGC, New Delhi. He has published more than 35 papers in international peer-reviewed journals. He has a patent. He has also presented more than 40 papers in international conferences across the country and has won Best Paper Awards for 6 times. He is passionate about using artificial intelligence in healthcare. He, with his student community, have built prediction models for diseases such as dengue, malaria, breast cancer. So I think he'll be in a very good position to enlighten us about the academic aspects of innovation. I welcome you, sir. Over to you.
Yeah, so good evening, everyone. Thank you, Achal sir, and all the organizers for having me here. It indeed a great pleasure to, to be here and to just put forward the thoughts related to the pertaining topic. So I'm sure that I know that I don't have much of time. So let me quickly get inside what I'm planning to talk this evening. So I'm sure that there are 2 types of people who are here this evening. One group is about the medical group, people from the healthcare, and the other group is maybe from the IT background. So I'm sure that all of you're going to really have so indeed a good time of learning many important things. Let me put it in, yes, okay, right. So I'll be, a few minutes, let me quickly, touch upon the topic that's what's given to me, unlocking the potential. And I would like to give you an academician's perspective, right? I'm sure that none of you would have imagined to see a slide like this. Yes, you are seeing a graveyard. I'm sure you may be thinking, you're talking about a health tech. What is this guy going to do about a graveyard? Friends, very recently I came across this thought that literally shook me up and also made me think a lot. The graveyard is the richest place on earth. Let me quote it once again. The graveyard is the richest place on earth. because it is here that you will find all the hopes and dreams that were never fulfilled, the books that were never written, the songs that were never sung, the inventions that were never shared, the cures that were never discovered, all because someone was too afraid to take that first step, keep with the problem, or determined to carry out that dream. I did not make this, but this was a statement made by a person called Les Brown. But it certainly made me think a lot. And I'm sure if you're going to be curious about what you're listening this evening, what I meant and what I put forward will surely make you think. So friends, this evening, I'm sure that we all have a lot of ideas. So, let me, I just have a poll that all of you would, make it the first poll. Yeah, ma'am, could you just put forward a kind request to all of you to quickly attend that so that you will really, we would get going. Yes.
Doctor, can you just go ahead? There, I'll just put out the poll. You can continue. You can continue.
Yes. You want me to stop sharing?
No. Go ahead.
Yes. Okay. So, meantime, when I'm just continuing, may I request all of you to take that poll that gives you interesting insights. Wonderful. Let's get going. So I'm sure that all of us, have a lot of ideas. And, how can you really make that idea? And that idea is not going to be, ending up somewhere after many years. Somebody could, as you could see here, somebody could, you need not be part of what I have told you. Let not your idea be buried with you, but your idea could be transformed into a product. And that's why this webinar is all about. Yeah. So let's move. It's so interesting to see, wonderful that we have 64% of our participants are innovators. Wonderful. I want to appreciate all of you, and also few of you who are unsure. You will be sure that you will also be part of this, a great journey, because we have Sanjana ma'am and Lalit sir coming up who have gone before us. Thanks, ma'am. So let's move ahead. Let's go to the next one. Yes. So we all have an idea. So, where had this idea come upon? Maybe there are a lot of backgrounds why this idea has come upon to you. And, we have many reasons and we have many backgrounds. But this evening, as I'm going to touch about this academic, I'm sure that there are a lot of things that would have impacted our lives. And I'm sure academic is one such factor. We cannot deny the importance of academic in our lives. Okay, so now, what do we do with this idea? If I ask you, do you have an idea? I'm sure all of you will tell yes. Suppose I ask you humbly, from the webinar first, second till 7:30 in this evening, how many ideas will you have? I'm sure that you will have n number of ideas. Is it possible that you run around or you move in the back of every idea? Possibly not. Okay, now what do you do with this idea? That's where everything lies ahead. So your idea remains that until and unless you're going to take it forward. So I would like to, as an academician, with my student community, I would like to put forward few steps, not theoretical stuff, but what I have practically seen in my own life that has helped me in my journey in the last 7 years. I'm not putting a theoretical here. Whatever I mean, that is from my own experience as a faculty, as a student, and also as being part of a small little dot that I'm working with AI, right? So, now, how do you really get your idea into your reality? These are the 6 things that I have tried to make sure, and in the last one, I am not there. But I can surely tell you the first 4 places I am there. Let me tell you, my friends, the first thing that I did like this: don't go it alone. If you have not heard it right, let me tell you once again, don't go it alone. This is the very first step that I have learned in my life. My wife is a doctor. I got all this AI idea and I went to discuss with her one day in my bedroom. And you won't believe we had a great fight that day, because what I understood about AI was what I learned theoretically. But practically, I never knew how to communicate with my wife who was a doctor, right? So I ended up fighting, but that also opened my eyes of understanding to know if I want to do something, I cannot do it alone. I need someone with me. Who can be with me? That's when I began to get starting connected with the healthcare professionals. And today I'm glad I'm here because I had a wonderful opportunity to work with, Dr. Rachel, Dr. Sudhir, Dr. Balu, and many other friends over there. So the very first thing is, you have an idea, you cannot do it alone. You need someone. But the important thing here is, whom will you share with? It's important that you go and identify the right people who can be part of your team. That is the very first key. The second key, do your research. Now, some of your students may, ask me, sir, you found out the right people. I have an idea. All these lecturers, I can never go and talk with them. Whom can I talk? Whom can I talk with? Friends, do your research. Every college has a portal where you can know what expertise a faculty has. It will give you really a great idea about who is good or who is doing what. That will really help you out to move ahead in that area. And also with your idea, I had something that I had to do with healthcare. I started going, for example, I want to do something with malaria, because malaria was, was considered, the Dakshina Kannada district is considered as one of the malaria prone area. So I went to the district health department. The DHO gave me an official order, making me understand to go to the 100 primary health centers. I took my car, 3 days I traveled to 60 primary health centers, and they gave me the records. And then I understood I cannot do anything. I can never develop AI model with the statistical records that I have. That's when I understood this is not the path I have to do. Let me go back to the medical colleges. So that was the second thing that I did. Do your research. Third one is developing a prototype. I know that I'm hurrying up because I'm literally, going out of my time. Priyanka ma'am, can we come with the second poll now?
Yes,
Achal
yes.
sir,
Yes, sir.
Achal sir,
2 more
how
minutes
many
left.
minutes do I have?
2 more minutes, sir.
2
Yeah,
more
yeah.
minutes. Thank you, sir. Yes,
We
yeah.
will have our second poll.
Yes, yes, yes. Okay. So now, friends, you have the second poll. You can kindly go and vote, or just do the voting. Wow, wonderful, right? Okay, can academics play an active role? Yes, yes, yes. Some of you, of course, there are some of you disagree with that. Some of you are not sure about it. Okay, fine. Let me tell you how. Yes. Academics generally, whether it plays an active role or not, it depends college by college. But in my department, because I am literally passionate with what I am doing, we have literally brought a lot of changes, especially our collaboration with the medical college has helped it that our students are able to do that. So I can surely tell honestly and humbly with 1000% that academics can play an active role in creating innovators. And because in my department, I was able to do some changes. Today, I have close to 10 people who have been working on some innovative things. So now coming to the third important thing, developing a prototype. Yeah, so that's something that is very, very important. Me coming from a software background, I come and tell that I wanted to build an app. Of course, we have built few apps. Now, how do you validate that? That's where the whole challenge is about. I work with machine learning. I have a lot of data sets. I put the data set and run. All of them give me 99.4% accuracy. And the first time I ran a prototype with Achal sir and Sudhir sir, and when they gave and it gave me 70, I was, what did I do? Is my program going wrong? That's when I understood that reality and theory is totally different. But today I can honestly tell, yeah, sir, I have a minute.
Sorry to interrupt you. Yeah, could you wrap up this first session?
Yes,
later,
yes,
if the time permits,
I will
come
do
back.
it. I'll do it, sir. Right.
Yes.
So developing a prototype, when you really have someone in your team who has a different skill set, who knows the ecosystem, that's where you could really, work your prototype and get your. And finally, the last three things is work on your elevator pitch, testing your product, incorporating your business. I'm sure Sanjana ma'am and Lalit sir is going to take forward in that direction. So friends, as an academic, let me give you three things. First, don't go alone. Second, do your research. Third one, develop a prototype. You can do everything, but there are two things that is important. One, I call it as PR, passion, relationship. You don't have these two things, you will fizzle out. So friends, what is the passion about? I could tell you 7 years in this journey, right? There are many moments that you feel done, but it's a passion that you keeps us going. Second one, the wonderful team you have and the relationship that you enjoy with them. So friends, as we start, many of you may plan to start this journey in your academic side. Let me wish you the very best, but I'm sure the path that I took will also help you to groom your ideas into your reality. That is from me at this point of time. Thank you, Achal sir. Over to you.
Thank you very much, sir. You have started from the graveyard, and then you have shown how people can rise above it and create a team. Yeah, you have shared your wonderful journey with us. Thank you very much. I'm sure participants would be having other questions also. Even I have many questions to ask you. When the time permits, we'll come back to you, sir. Thank you very much. And let's move on. For the next topic, before that, let me bring your attention to the fact that apparently we are at the fourth industrial revolution, and this one is governed by automation and data exchange, right? So for this, AI, artificial intelligence, is considered to be the cornerstone. This is the one which relieves us from doing mundane activities, repetitive activities. It is that powerful. And just to have an idea how powerful it is, try to search for the latest buzzwords. It has eclipsed everything in the internet, including metaverse, and everything is just sidelined now, thanks to Bard and ChatGPT and so on. All these upcoming AI technologies have helped us. It's going to help us much more. And for this, we have with us Dr. Sanjana. Dr. Sanjana SN is a distinguished public health specialist and diabetologist, renowned for her expertise in leveraging digital health technologies and artificial intelligence. She is the founding member and manager of digital health at Eka Care. She has contributions in the prestigious IAPSM textbook, and her research has been published in various national and international journals. In her current role, she has been instrumental in creating Ayushman Bharat Digital Mission compliant EMR tools, AI-powered self-assessment tools, digital lockers, advanced monitoring solutions for heart rate and heart rate variability. She holds an advisory position in the Association of Public Health Technologists, APT, where she contributes her expertise to further the intersection of public health and technology. Her role as a trustee and joint secretary at Rebuild India Foundation, as well as director of administration at Noble International School, reflects her dedication to providing quality education for underprivileged children. So her commitment to creating a positive impact extends even beyond healthcare. Dr. Sanjana, we welcome you. Over to you.
Thank you, Achal sir. Again, thank you for the entire organizers and the panelists. Dr. Ruben sir, that was really, motivating. I hope many more innovators get inspired by that talk of you. So again, time is what I think is the key here. So I will get right into it. Dr. Priyanka, can you share the first poll?
Yes, yes.
And,
Let's make it more interactive. Yeah, I'll share it.
okay. No, I think the previous question, like let them answer this also. I'll get
You want both the polls? We can have after this. We can have another poll, and then you can get started.
this. I'll make a note. 46. It's almost it's almost like the elections of Karnataka where we're not able to figure out what's the okay. 45 say TG. 34 is timing. Okay. Can we have the next poll? I'll address this when I think come to that point in the presentation.
Yeah.
What is it? Yeah, this. How many of you have created your ABBA ID or in this group? Okay. Almost. Okay. So this is giving me a rough idea of, how at least to get the pulse of the audience, but great. So let's start. Thank you, Achal sir, for that, introduction. So okay, I'm going to go ahead.
Yeah.
My screen is visible, right?
Yes, yes, yes. Go ahead.
Okay, so I will not repeat myself. So I work predominantly in Eka Care, where we have built all these health technologies. So always I think of technology as this miracle drug or miracle solution where there's a identified problem. And I think all of us here are aware of how the healthcare in our country has almost been its Achilles heel, right? There have been so many challenges in terms of the policy, and at the doctor level, at the patient level, in terms of doctor patient ratios, just the cost of a health expenditure which falls on a patient. And yeah, I can go on a separate topic around that, but what is the solution for it, right? And here I think we are at that prime time in this journey of healthcare in our country. Sorry for that glitch. Yes. So, as I was saying, we are very fortunate. I think we are at that brink of a revolution in healthcare, because what we call ABDM is being touted as a UPI moment in healthcare. Like, I'm sure if we just sit and think, right, we cannot think of a time when we were using, our wallets was filled with cash and we were we're searching for change. And that's the kind of revolution UPI got in finance. So imagine a similar thing happening in healthcare, and which is a much more complicated ecosystem because of all the key stakeholders. So that's what ABDM is all about. And seeing like how only like 50 or 40% of us have even created an ABBA ID. I don't know how many of us know what the implication of ABBA IDs are. And it's been like 2 years since ABDM has started, and there's been a lot of conversation. So I'll just touch upon what it actually means and what does the future look like, right, with ABDM, and how big of an impact and how radical it is. So ABDM, to put it in short, is digitization, not for the sake of digitization, right? We are going to go digital, and it's being touted as so radical because every key stakeholder in the health ecosystem needs to go digital at the same time. So be it you as a patient, you as a doctor, or a hospital, or an insurance company, we are all going digital, and all these innovations and everything is coming right there. And how do we streamline this? And that's where ABDM is similar to the unified payment interface. We have a unified health interface, which becomes like your gateway or repository of all this information. So to put it in short, like ABDM, like this will give you a picture of how ABDM becomes a registry. So I'll just give you a simple use case. I am a patient. Let's say I go to hospital one for some problem to a doctor who's using a HMIS one. I have got a digital prescription completely playlist, and 6 months later, let's say I go to hospital 6 to meet a different doctor, and with my consent, because of ABDM, there will be a point where a doctor in hospital 6 can get my records from my prescription or whatever from the previous doctor in hospital 1 with just a single click on my mobile, only if it is an ABDM compliant system across the board. So, and this is not restricted only to a digital prescription. This is restricted to medical records that we have. And all of us here, I'm sure we've had some records which we lose track of, right? Like how many, 3 years back, what was my, what do you say, HDL level or HbA1c level. And there is so much of medical bulk, especially in NCD records wise, that this is going to go completely paperless, and just the penetration of technology across all the key stakeholders will have like 10x, we'll be reaping 10x the benefits because of the telecommunication channels which will open, and PHR apps are nothing but apps like Eka, and there are more, like there's Paytm, there's Briefcase, and many more which are out there, who are mainly creating ABBA IDs and getting people into this healthcare journey, and which I'll be talking about in the next slide. But this is the impact that it will have. So every key stakeholder is being asked, and again, this is voluntary and not forced, but if you need to reap the benefits and get that, like I think even Dr. Lalit will be touching on connected patient stories, all that will happen and is happening because of ABDM, because we are all talking in the same language. Interoperability is like the motto here. So coming to with this background, like we created, I probably, if time this flow is, what linking your ABBA ID means, what creating your ABBA ID means. But Dr. Achal sir, I hope I'm sticking to the timeline, but I'll move on to the next part, which is AI assisted health innovations. Here, I think I would like to spend more time because these are on ground learnings. So I was also new to this field. I think it's been 3 years in this field of health tech that I have come into, and the learning has been like eye opening. And I have chosen these three. So we have multiple products at Eka, but these three are kind of sitting to all the, the happy stories, good stories, and not so good stories. So I'll start with the first. Yes, sir.
Yeah, yes, Dr. Sanjan. You can shed more light about how or where they can start with. Your time is running out, sort of. So yeah, what
Okay.
can be the starting point for all of your success stories?
Okay, I'll just tell you the success stories. It almost to put it in short, it goes back to the poll question that I had put. Like, how does what is your deciding factor for any AI assisted health tech? What decides? Is it your final product? Is it your market or your timing? So in the first case, I'll like run through it faster. First case, we had an amazing product, and I know Achal sir is a diligent user of this, where we just ultimately just monitoring heart rate. And if you're a doctor, you'll be like, like what is there in this? It's simple heart rate. We can always just check. But we've had amazing success in this particular story because maybe because of how it was packaged, and it went out to the right target group, which is the younger group, which are more health conscious, fitness conscious, and things like that. I'll quickly move on to the second. If time permits, we'll come back. The second is a feature where you're, like we spoke, I think if you go deeper into ABDM, it's a medical record locker as well. So since we've had so many medical records, I think a big challenge right now in the Indian healthcare system who are in research is we don't know what are our Indian standards. Like we know BMI is different for Asian and non-Asian. So imagine the implications of vitals as well. We rely a lot on the Western population standards, right? So this kind of data which is coming, we can actually see where you stand in Indian population. And when that data set increases, the scope of research and analytics which come out of it is like endless. This worked as a medical record, was a very good feature which clicked very well, but population insights not so much. So here we are thinking maybe the target group, right? That's where your target group implies, like maybe it was, if it is a little more educated, doctor related or researchers, they might find more value in this rather than a layman. And coming to the last one, which is this bittersweet story of where a lot of doctor like the clinical team within the company, we had invested, we created very clean algorithms with the data science around symptom assessment, basically a virtual assessment for the doctor where we take a history of the patient. So the idea was to reduce the time a doctor spends while taking a history from a patient, very cleanly triage a patient, and the use cases are endless. So the product is amazing, but the timing, I think we were wrong at the timing, because India is not yet at the population level very digitally literate. You as a user are okay to use TikTok maybe in a TikTok or Facebook in a three tier or a rural place, but maybe not so much for checking your health. You would rather go to your doctor who's right next to you, and that doctor human relationship maybe we've not been able to crack, because in the West this has worked really well. Like if you can just check this Babylon, this Ada, who have done really good job and in this place, and we will probably revisit this. But this is what I'm trying to say: when you're creating a product, like even Dr. Rubin sir said, at the table you'll have a very different idea of it, and only when you go to the market. So you need to take it there. I know you need to invest that amount of time, money, whatever it takes, and the learnings and maybe repackaging will come only later. And AI and all this is AI assisted alone will not only matter, because even the domain expert needs to come in. Like of all the records, a clinical doctor should be sitting there and telling HB is important and probably not an MCV for this thing. So how much time do I have, sir?
It's almost over.
Okay, I'll just touch upon like the
Yeah,
last.
if the time permits, you can come back to it. No,
Yes, I just have a small video. I can share it across the group as well after the talk. But yeah, I would like to just say, are we ready for this change? I think we need to drive a lot of this change as like a certain part of the society who are invested in healthcare and who want to see that change, and bridge the demand and supply side gaps. And again, it's a very collaborative approach where it's not only a doctor who runs the show, it's not only a technical person who runs the show, it's not only data science. We together is what we can solve healthcare in India, and make the big change. I would just a closing note: I see technology as a steroid. I mean, all the doctors will get the context as well. I mean, when used right, it can create magic, save lives, but once you start abusing it or you use it in the wrong sense, that's where things go down the drain. And that's my closing statement, and hopefully we'll come back. Thank you.
thank you, Dr. Sanjana. You have spoken about how we need to time our product, and what about the product itself, and whom we are going to target this. If any of these factors are off, then yes, we might meet with the failure. Yes, thank you for shedding light on that. And also regarding ABBA ID, we need to buckle up and start registering, I guess, if we are serious about this.
Yes.
And finally, the most important thing which I need to stress upon is the localization. If the data is not localized, then yes, we are way off. Just like you said, the BMI, Asia and non-Asian, that itself is going to push us off the track. Thank you very much. We'll see whether we can come back to you later. Thank you. Okay, so the final topic for today. For this, let me bring your attention to the fact that we are living beings made up of mind and body. Without mind, the body is useless, and without body, the mind can't exist. Why am I talking about this? Because I always considered the algorithms, the software coding, and everything to be the brains, the mind, and the device on which it acts as the body. So we have been talking about the mind, that is the AI. Now let's talk about the device itself. Now, the device itself is like a whole different story. The challenges involved in thinking, designing, bringing it to the market, and verification, validation, all sorts of things. So we do need some expertise on this, and that's why we have Dr. Lalit Manik, right? So Dr. Lalit is a co-founder and CEO at Metal. After finishing his MBBS, he completed his Masters of Public Health at University of Dundee, Scotland, UK. Over the following years, he has undertaken various ventures, starting with the Hello Doctor 24/7 healthcare platform for online consultation, It was started way back in 2009. And in 2017, he co-founded another company called MedTel Healthcare. It's a data-driven, enterprise-centric consumer health platform which partners with leading hospitals, healthcare companies, and retailers to provide access points to a personalized healthcare. Basically, the goal is to engage people with care providers much before they fall ill through connected healthcare platform and thus improve the standards of care. Not only this, he has worked closely with Ministry of Health, Saudi Arabia, as a public health specialist and module leader of health informatics. So I think Dr. Lalit will be in a very good position to shed light on this. Dr. Lalit, I welcome you.
Good evening, all. Thank you, Dr. Achal, for the introduction. And thank you, Dr. Sanjana and Dr. Ruben, for your inspiring speech, I would say. And really, it is goosebump for me. And in this evening, all doctors talking about AI, IoT. I mean, it's really interesting. We have never discussed this in our close auditorium or lecture theater ever. But this evening is very much interesting. So, so I'd be talking about connected care and remote patient monitoring. I mean, how the world has been changed. I mean, post-COVID, the world has been changed entirely. I mean, the technology has been adapted in the last mile. I mean, I would say, I mean, everyone is now, willing to adapt technology. So I hope my screen is visible to all.
Yes, sir.
Okay, thank you. So I'll start with some anecdotes. I mean, what it covers today, like connected devices and platform, remote patient monitoring, and some real-world use cases. So I will start with some anecdotes. And all know that Dr. Sanjana was telling how the industry is moving in the coming days. I mean, you can see the connected medical device market due to close out to 2023 with $23 billion. I mean, it is not just connected medical devices. Now you must be heard about software as medical device. I mean, the software is going to be, certified through CDSO Indian entity, that the apex body to certify software and medical devices contributing together. So if you see that what is connected care, I would say, in very simple language, I would say it's a layman term, like when a patient leaves the OPD or the outpatient department, he reaches home, he needs to connect with the provider. That's, I understand, the connected care. And how does it gets connected? Through technology, medical devices, softwares, and the existing system that is like electronic health system, Dr. Sandra was telling you, EMRs and all. This all needs to be integrated in a common platform. So if you see the medical device connection, I mean, the different protocols like Bluetooth, Wi-Fi, then radio transmission. There are so many connection protocols are available at present to connect from from home to hospitals. I all know the market, and we all agree now that this is going to happen, and COVID has made us to believe it. So if you see, the remote patient monitoring market, these are the numbers. I don't need to again explain this. This is the TAM for US market, and India is just entering into this, and already the adoption has gone up. So I'll tell you how the connected care is being really used in the real world, real world scenarios. If you see, I have identified a couple of areas, like where the chatbot, you can see the Healthily, Ada Health, Babylon, Wisai. It's an Indian company in Bangalore. They are serving now to the rest of the world for the mental health. Though this is a simple chatbot, anyone can adopt in his clinic, in his hospital, to manage thousands of patients. And this is going to happen, and where the relatively less number of doctors in India, in rural areas. If you see the teleconsultations, like there are many companies, I tried to name few of the companies like Medibody, Practo, Eka, Apollo, so many. And if you see global scenario, you can say HealthTech, PlusCare, and there are many. So we all need to believe that the technology has already been adopted in many different ways, either through insurance, either directly B2C, or direct or through any employers through channels. So these are the use cases. Then you can say that diabetes care, especially like the Gluco, One Drop in the India, Fitterfly, Twin, Oviva in UK. Now India is having 100 million diabetic cases. I mean, in the June, everybody is celebrating, or I don't know, but everybody is writing that we are a country with 100 million diabetic patients. So it's not about celebrating this, but rather it's a concern for Indian, in all our as Indian or as a doctors. So you can see the hypertension care, like, I mean, these days in our scenarios, if you practice, the patient comes to the hospital and goes back home and we prescribe some medicines. But here there are companies who monitors from them home. In Indian company like Healthify Me, they are doing pretty good, and their AI, modules are really managing thousands of patients for manage obesity, diabetes, and hypertension. So there is a company called Livongo, you all are of it. I mean, the US, they are work with many payers and insurance companies, and they to manage BP, blood pressure, hypertension, diabetes, and other care. So pregnancy, you can see that the adoption, and the Indian company Janitri, they have built a medical grade devices where they can monitor fetal heart monitor and uterine contraction. So what I'm trying to tell you, like, these are all real world cases, and this has all been started for a few years back, and this adoption has been huge. Again, you see the cancer care, there are many companies, but in India, to be honest, it's evolving, and people are trying to accept this technology in their OPD, like providers are accepting these days, and we need to evolve in this area like cancer, diabetes. And we expect that if I, as a clinician or an innovator, I would say what I expect, anybody is coming to doctor's OPD, he must be prescribed some digital mode that the patient can be monitored from home. So if it's a cardiac care, there is a company called Trigop from Bangalore, and they have patients in Singapore, Japan, and all. So now they are having ECG being done in the far remote locations, and the AI is providing review for this. So there is a company, Indian, or a couple of companies are there. So these are all been happening around us, and this time for doctors and providers to adopt technology to serve more patients and to have their reach more. So we at MedTel, what we do basically, we are building a connected care platform where medical devices and a platform that gives insights to the patients. It helps in population health screening, I would say teleclinics, I would say doctor's clinic, that walk-in clinics, everywhere this product can be used. And we provide insights, population health insights, which helps the providers to take decisions, also engage the patient when he reaches home. So there is a connected health hub we are going to launch, that where the hub will just capture vitals from the devices like blood pressure, blood glucose from home, and it will send to the providers and through HMS, any other third-party platform being used. So it is simply a hub that is with a connectivity and SIM inside it, will capture data from glucometer you are using these days, but all these devices should be having some communication protocol. So, to the young students and doctors, those who are willing to get into the innovation or the having some AI tools or anything they think to getting into, these are the ways. You need to ideate, and Dr. Rubon was talking about the incubators across India. And now we have quick access to nurture our idea in this incubation center. And also there are different technology readiness level, which BIRAC and other institutions provide support. And also this provide initial seed funding, which is very, very important, which was not before. That can be given to the innovators, where they can innovate their ideas and also take help to build new technology and new product. And if you see the medical device policy and all this, all is new, and this is to 2023. many IITs, there are device design manufacturing sites have been identified, and they will support innovators to build, and they are having an infrastructure where they can support new device manufacturing and all. And regarding certification, and CDSO is coming up in association with the research labs and IITs to make things easier for the innovator to provide relevant certifications. So I would say again, the impact that we are bringing together with partners, I would say that many projects we have deployed in remote locations. All these projects have been deployed in the tier 2 or tier 3 or tier 4 cities. Digital diagnostic service in sub-center. In India, there are 2 lakh sub-center, 30,000 primary health centers, and 6,000 community health centers, 100 million diabetic patients, 220 million hypertensive patients. Why I'm telling this number? These all centers and all patients need to be connected either through device or through platforms. This time has come. If you can think to manage those patients, this is the way forward. So if you see this impact that Arogyam house-to-house health screening, now we are providing data to district administration. They can see and they can know that who are the patients in the community they're having hypertension or diabetes, and how they can have longitudinal data from them by frequent health screening and other mode through the health centers and all. And leveraging IoT medical devices for maternal care, where we are providing connected devices to the the sub-centers, the ANMs reaching out to villages and conducting ANC checkups and collecting data. And we are providing real-time insights to the decision makers that they know these are the high-risk pregnancy. Before, there was no data. Even for months, they don't get data because they all enter manually. But now they don't have to enter manually. These are all connected devices. The beauty is that we have made it offline, developed offline applications where pregnant women are screened in the village without even having a network. If you say there are a few other projects, these are all live, and another project recently we deployed in 110 centers and ECG, the connected ECG device. So where the ECG being done in the PSCs, sent to the medical college where the doctor gives review, and immediately the patient gets report in his mobile. Even the last mile primary health centers, nurses or CHO, they get the report. So I think the world is changing, and the time to adopt this technology, I think this will bring the real change on the ground, what we talk about the health as a challenge. Thank you. You can reach me at lalit@medtel.in for any questions post this webinar. Thank you.
Thank you, sir. We don't have much time left, but I would like to ask you one question. Considering you have a success story to tell, even though you might have had a couple of deviations initially, then you made a success story. For the entrepreneurs or the ones who want to have a startup, if there is one line of advice which you want to give, what would it be?
Yeah, I would say one line is get ready yourself. I mean, for at least 5 years to spend in this space. You never get overnight success. I mean, your passion and ecosystem, and Dr. Owen was telling very important thing, don't go alone. You need to ask for help, and the ecosystem is ready to help you. If you have an idea, you have to go behind the help. I would say the ecosystem, the incubators, the funding agencies, you have to ask to get help from them, and you are not alone. The world is watching you. The ecosystem is ready to help you.
Thank you, sir. Thank you very much. You have told us about the ease of connected healthcare. I mean, how it can be beneficial when there are no healthcare providers in the remote places of our country. How the medical device policy by our government might be, lending us a helping hand. And of course, this will be a good starting point for all those who want to innovate. Thank you. Thank you very much, sir. We are almost about to reach 7:30 now. If I am not wrong, there are a couple of questions which are posted before the webinar started. Now, I don't think we have enough time to address all of them. Some of them have been already addressed by one of the 3 speakers. Whatever we couldn't, we will try to post it individually or through WhatsApp group. I think I can conclude the session now. Dr. Priyanka, shall we? Okay. So let me summarize what all we have been through from past 1 hour. We started off with Dr. Ruben's excellent talk about how what a graveyard is made of. That is our unfulfilled ambitions and unfulfilled desires. From there, we can rise and we can move forward. But we have to think, or we have to know one fact, that you are not alone. You will have to always ask help and keep trying and retrying until you make it a success. Then Dr. Sanjana told us about how the product itself, of course, which is important. Along with that, we need to time this product properly, see whether the audience is right for that, and who are this audience, who are this target group, are they ready yet, where are they? These sort of things we should be kept in mind before releasing a product. And of course, the importance of ABA ID and localization of your data. Finally, Dr. Lalita Manik said that connected healthcare is coming up in a big way, and if we want to get this, we just need to take a jump. Whatever happens, yes, if you're passionate, you are going to find a way. There is ecosystem available, and the government has got medical device policy. So yes, it should be helping us in the right path. Yeah, that's about today's session. Thank you, everyone, for joining us.
So yes, thank you so much, everyone. So as we come to an end to this insightful webinar, I would like to express my gratitude to all the participants who have attended, that too on a weekend, and definitely all our panelists, for enlightening us with your expertise and for enriching us with the understanding of the health tech world. So very much thank you to Dr. Rubin, Dr. Achal, Dr. Lalit, Dr. Sanjana, APT and Grid Council, and definitely all the participants. And I would request our speakers to wait for some time before we drop out. We can take a group picture too. And also, I would want to know our participants that after, we will be editing this webinar and we will be posting on Grid's YouTube channel. So if you have missed out on any part, or if you've missed on attending this, any of your colleagues, please let them know. You can subscribe to our YouTube channel. Also, we post this webinar, we will be sharing some reading materials. So have a tab on your email. So we will be sharing that too. And for any queries, you can connect with Grid on academics@gridcouncil.org.
Okay, myself, Dr. Tamar. So I'm a third year PG resident from UCMS Delhi. So I have one question to ask. Throughout our MBBS curriculum as well as PG curriculum, we don't have any interactions with technology people or to even discuss with such ideas. So in India, do we have any forum or a networking opportunity which will connect the medicos with the technology people? So I just wanted to know that, because many people are already working on that field. Is there any particular forum which has been established where we can connect a network to discuss our ideas? Thank you.
Can I know, know his name?
Dr.
Doctor?
Tam.
Sir,
Tamil.
Tamil.
From where are you from?
Sir, I'm from Delhi.
Okay, thank you. So I think you need to get connected with APT and Grid Council first. I mean, Grid Council is talking about, and I'm here, you have my mail ID, you can get connected. That is fast thing. But always, the LinkedIn is a good platform where you can reach out to people. I mean, that is second thing. Third thing, I would say, you just go and Google, you would see that how many health tech incubators across India. There are many these days. I mean, the Bayrak is doing a wonderful job, and they're giving big grant of 50 lakhs to every year. I think at least 100, 200 innovators, they're having great ideas. So I think you need to reach out these ways. I would expect Dr. Sanjana and Dr. Achal and others to add.
Yes, thank you, sir. I think you covered. I was almost going to say the fact that you're part of this webinar. These kind of webinars is where you get to interact with people from both the worlds. And like we said, I think initially this is an upcoming field where we're all going to be collaboratively working. coming from the same medical background, that is a challenge that we're seeing, that, we as medical doctors are not at all exposed to technology during we're so used to pen and paper, and now suddenly we're asking even younger doctors to switch to EMR is a challenge. So to answer your first question of how can you connect with, if there is an organization, like sir said, there's APT, there's GRID Council, and I think they have been, their foresight is amazing, because I'm a student of many of Balu sir and Sudhir sir, and so find your right seniors and mentors who are in the same field, who can guide you. And like sir said, LinkedIn is always there. Speak to people who are from your same field but in this field, and that's been a biggest in my journey, that's been a big influencer. And yes, attend more webinars, become part of these kind of councils, and you will get exposed to it at least, and then the journey can begin at any moment. It should not wait until you finish your PG. That's my only thing. So if there's anything I've left out, like Sir Achal sir can.
Yeah, whatever Dr. Lalit and Dr. Sanjana have said, they're all true. I would like to add one small point to that. That is, you said you are in medical college. What is stopping you from making friends with people from engineering college? As simple as that. You are a student, they are a student, they need a project, you need a project. Just join hands and you can start right away. No? So yes, it's all up to you, how enthusiastic you are. All the best.
Thank you so much, sir, for organizing this webinar for us. Thank you, sir.
Hello.
Yes. Yes, Dr. Mukta. Yeah.
Hi. I have a question for Dr. Lalit Manik from MedTail, who is also the
Yes,
co-host. Hello, sir. This is Dr. Mukta over here, third year JR from CNMCH. So I don't know if I'm audible.
Yes, Mukta, you're audible. Go ahead.
Hello, sir. Hello.
Please go ahead.
So, I mean, actually, I was going through the website itself of MedTel. So there are a lot of services that it provides, like digital therapeutic solutions, population health, pregnancy, diabetes, hypertension, COVID-19, and I mean, how do you take care of everything, like and the follow up and anything? If I mean, this is all through teleconsultation or telemedicine. I mean, you do not all virtual, like you do not a no touch method, if I'm not wrong. Is it so?
Yeah. So first of all, we empower the care providers like doctors, hospitals, even the governments. We give them technology and entire tech stack or solutions so that they can take care of their patients. We do not directly handle patients. So patient always belong to the care providers. So we call ourselves a B2B SaaS health tech provider. So basically, we provide software, hardware solutions, connected devices, and everything to the providers. Providers, it may be hospitals, insurance, pharma, they are the providers. So and what we do basically, we in the software or the platform itself, they capture data and they get insights. They have like the coach login, they have nursing login, everything. So that the hospital it'll be easy for the hospital to provide services to the patients. I hope I could answer.
Yes, sir. Thank you.
Thank you.
If we can take one last question, if anyone has any questions, please.
Good evening. Can you hear me?
Yes.
I'm Dr. Mithila.
Yeah.
I just want to understand if there is any service for geriatric care. Generally, the geriatric care facilities which are available are generally diaper and add-ons to healthcare services, but counseling kind of sessions for the geriatric care. I'm not sure whether it is available. I'm actually trying it for my father. Yeah, he's healthy, touch wood, but there is a requirement of somebody who requests to be talking to him just to understand whether how is he's etc. But I couldn't find anybody who's giving such care.
I would say there are companies like Portia, Night Angels, and many. I mean, there are providers. I don't know which city
I'm
you are
looking
from.
for it in Chennai.
Okay, I think these two companies, they have presence in Chennai. It's not,
It's not.
advertise them, but I would say these are the providers available, and they have national presence.
Okay.
So they provide geriatric care and home care solutions, basically.
Actually, I'm not looking for home care services. It's just that somebody needs to go and have a general talk. I don't know what care it is called. Since touchwood, he is healthy and doesn't require any kind of diaper care or
Got it.
physiotherapy care. This kind of services are not easily available for people who are healthy at this age. They only require somebody to talk to.
I think
Which
AI,
children do not have, their children do not have time since we are all busy.
I think the generative AI we are talking these days will come and play this role. I think young innovators, those who are attending this webinar today, I think they need to build, and they have a problem statement here and then. So they need to work on this, and this is one of the important health problem. I think the health patients want to talk and to know the problem, and the AI can solve this.
Just to add on, like there's a Apple feature. I mean, it's yet to go live, I think, where you can log in your feeling. I know this is not exactly what Dr. Mitali was looking for, but I think there's development in that. And like Sir said, I'm sure there are other, groups working in geriatric care solving this problem. But you can explore that on Apple Health, where you can log your emotions, how they're feeling, and that's just an idea to just go back and check.
Thank you, ma'am. Thank you so much, ma'am.
Dr. Lalit, if I'm not wrong, you had mentioned about Visa. That is
Yes.
an award-winning
Yes.
app. It does
Exactly.
give you direct link to therapists, but I think it's a paid service if it is
Yes.
they're going for therapists. And if they want to try out, there are always this generative AI like Bing or Bard. They do make you feel good when you're low. I mean, sometimes there will be mishaps, but yes, they do give a good service for free, so they can try it out.
Thank you so much, sir. Thank you so much, all of you.